Thank you so much, Hur. Thank you. Next, ladies and gentlemen, we delve into innovative strategies, best practices for promoting preventive healthcare and early intervention. Please welcome to the stage Her Excellency Dr. Farida Al-Hosani, the Chair of WHO PIP Advisory Group and Adjunct Associate Professor, College of Medicine at the United Arab Emirates University, Boyd Chongphaisal, Vice President and General Manager of the Gulf, GlaxoSmithKline, and your moderator, Sally Mousa, Senior Presenter at Forbes Middle East.
And here we go, ladies and gentlemen, welcome to this very special panel. So, in this world where the adage, prevention is better than cure, it has never been more critical. This session is going to be delving into the transformative power of proactive healthcare, from cutting-edge health technologies and personalized medicine to innovative public health strategies. We're going to be exploring the kind of interventions that are reshaping both local and global health landscapes. And so we are so pleased to have with us two incredible leaders in this space. Her Excellency Dr. Farida Al-Hosani, Chair of the World Health Organization's PIP Advisory Group, and Boyd Chongphaisal, Vice President and General Manager, Gulf at GSK. So good to have you both with us.
Same here.
Now, Dr. Farida, if I can start with you, Your Excellency, you're, of course, the reassuring face that all of us would turn to every single day during the COVID-19 pandemic. And it's been 4 years since that time. What are the changes that are taking place at the regional and global levels in the area of infectious diseases, and what are the new innovations in this domain?
So thank you for this arranging this wonderful event outdoor. I believe that the infectious diseases landscape significantly changed over the last few years because of many factors, such as climate change, urbanization, and also globalization. I believe that COVID-19 pandemic in 2020 onwards exposed the vulnerabilities of the global healthcare system. And we could see that there is a real change that is required to the global dynamic system, but also to the local healthcare systems as well, to re-emphasize on certain aspects. I would mention two significantly important, especially for the emerging and re-emerging infection, which is a robust surveillance system and a rapid, strong response systems. Those are currently one of the biggest focus at the global, and I'm sure that also at the national system, reimbursing on the lessons learned from COVID-19 pandemic, and also being prepared for and increasing future challenges caused by the climate change. So the well-being of the community is the core and center of every successful community and country.
I would say that that is one of the biggest changes. The last COP actually had the first ever dedicated health day because it is so incredibly interconnected, as you say, Dr. Farida, incredibly important there that we make that connection. Boyd, if I can come to you, talk to us about how GSK approaches proactive health interventions. And for example, particularly as we look at our lifespans. We're all living longer now, but what does that mean for our health span? How are we, in fact, getting older?
Thank you, Sally. This is really, well, first of all, good to be here. You know, it's not very often you're going to wear sunglasses on the stage.
Yes.
But look, I think it was loud and clear on the pandemic preparedness, and then how can we really step up as well, you know, as a private sector, to be able to partner with public sector, with academics, to make sure that we are more prepared for the next pandemic. And again, for us to look at, you know, how we really look at the health span and lifespan. We can see that we are now living longer, healthier. We like to get different lifestyle. This is where we are in this, you know, very nice, you know, resort. But how can we keep this going? And as we age, we'd like to age, gracefully. We like to age, and stay very healthy. Have the lifestyle that we hear this morning about event will be happening tomorrow morning, for example. Can you imagine people live, work hard all their life, and then at the end of the lifespan, the last 10 years, it's going to be bedridden, you cannot walk, you cannot go out and have fun and enjoy. How can we minimize that to the point that the person can contribute to the economy, to the GDP, to the family, right? And reduce that gap of the healthy health span, versus the lifespan. So right now, as we stand, let's say, for example, in the UK, there are 10 years gap between health span and lifespan. Can you imagine if we can reduce that gap of 10 years down to 5 years? That 5 extra years can contribute a lot to the family, mental health for the family, emotions, and for the economy for the country. So that to me is how we're going to do it. So early intervention, prevention, the way Dr. Farida talked about would be super helpful, because that to me is the way we can look at for the future as we stay healthier and live longer.
Absolutely, because we all do want to live longer, but we still want to be active, we want to be vital, we want to live well. And so to that point, Dr. Farida, if I can ask you about what you're seeing in personalised health, the kind of treatments, the kind of preventions that are becoming more central to healthcare, in particular proactive healthcare prevention, and how can we use and harness AI and these kind of things to really get into that?
I think a couple of years back, we were talking about personalized health as a future. But currently, it's really the present. And there are many technologies and advancements that helped us to really reshape the way we are delivering care, and we move from hospital-based services to more of home-based and personal care, that the patient is taking more a proactive role in, for example, diagnostics, like, for example, using home-based testing kits, which was used during COVID.
Yes.
So it helped a lot of people to avoid the long waiting lanes and do a simple diagnostic in their homes. And this is, I think we will see more of that in the future. In addition, we have the mobile apps that are really also playing a major role supporting the doctors and nurses in the hospitals, providing information and empowering patient to take care of himself based on his own condition. There is a lot of innovation that is going through this direction, but also we have to think about how we can use AI as well. And again, AI now is a reality. It's not the future, it's the reality. It's just how much we would invest in AI to address our current challenges. So I think looking at healthcare 10 years back is very different from this now, but I think that we are also in a transitional phase. So we will see a lot of changes that are happening to the care delivery model and to the prevention, definitely, because we all believe all our systems that, I think the mic, okay, that prevention is the best invention intervention care. So the more we invest in the prevention,
Microphone, guys, do we have another one we can give, please? Thank you so much. Thank you, I appreciate that. Yes.
Thank you. Is it working now?
Yes.
So the more we invest in the prevention and in the well-being, the better quality of life we have for our community. So definitely there is a major initiatives that are coming into the genetic screening, personalized health, and mobile-based health as well.
I love the example that His Excellency gave earlier, Khalfan bin Hun, talking about there's a computer that's just going to tell you, what's going on there as well. Let's talk about now medical tourism, Boyd. And, this is a global market worth almost $32 billion last year, and is expected to grow to almost $53 billion by 2027. That's according to global data. the UAE is actually amongst the most popular destinations for medical tourism, but there's still so much room for growth there. So what are you seeing as crucial to making that happen?
Thank you. It's going to be a combination of many things, just to add on to Dr. Farida asked a bit earlier. As we know, we like to live longer and healthier. GSK is investing a lot into AI as well. Can you imagine right now that we can really look for new innovation? It used to take 10 years. Now it could be less if we use AI, right? We know we have genome, data in UAE as well. Can you imagine we have 36 trillion cells in the human body, okay? And each cell you have about 20 plus genome sequencing. Use AI going to help us do a lot of work in that space. That to me would be the key turning point that we can hopefully get new innovation out to protect people, to prevent illness way before they get into that critical illness. So that part, we can talk about medical tourism in the way that we can do early detection, early intervention. Dr. Freya talked about vaccination. We have vaccines for adults right now, lining up. We have flu, we have HPV, we have RSV, shingles, many other vaccines that is being rolled out for adults. But we need to have awareness and to know why are we doing it, who should get it. That to me would help us to live longer at the critical age, so you don't fall sick, but prevent yourself early, way early. So the data will give us some sign. His Excellency Khalfan talked about that robot would talk to you. And that's exactly where we are. Once you know about that, you do intervention way too early so that you don't fall sick. So how do you do that? So we're working on that space as well.
Amazing. And a last word from you, Your Excellency, on that and the importance of how we can see, what are the most important partnerships that you would like to see to take that forward?
I would really definitely encourage public-private partnership.
Yep, take this one.
So private sector has a lot to offer when it comes to innovation, saving lives and improving the quality of healthcare. So there is a lot of partnership as well, multi-sectorial. So innovation and technology will not work without a really connection with different sectors. In UAE, we have worked with Etisalat, academia, and many other sectors. Even the transport sectors can help us to plan and to also design a better healthcare system for our communities.
Absolutely. And when we talk about business, HR, taking care of our people in our companies, there's so much that can be done at every level. Dr. Farida Hosani, thank you so much. Boy Chongphaisal, thank you so much. Ladies and gentlemen, please thank our esteemed speakers. Amazing. Thank you.
Thank you so much, your amazing panelists. Now, ladies and gentlemen, we're going to explore how integrating world-class healthcare technologies with exceptional hospitality is redefining the patient experience. Now, please welcome to the stage Dr. Marwan Al-Kabi, CEO of Sheikh Shagbut Medical City, Christian Schumacher, Executive Chairman of the Emirates Hospital Group, Dr. Muhaiman Abdelghani, CEO of Faki University Hospital, Hasham